Hi, coaches, and welcome to Mosaic's newsletter. This is an educational piece on safer drug use during COVID. We hope to discuss with you today some helpful pieces of information that you can integrate into your discussions with patients, whether it be in person, over the phone, or via telehealth. We want to talk about a piece of information that we have distributed to our Mosaic partners, but that we've also attached to this newsletter. It's an informational postcard that discusses safer drug use during COVID. So we understand that some of you may not be working in your normal setting right now. You may have transitioned to a remote role due to restrictions placed on your facility. So it'd be helpful to discuss with your supervisor perhaps the use of these cards and this information. And perhaps the staff at your facility can also help distribute this information if you are unable to do so in person. So we understand that there is a lot of competing priorities right now in healthcare, and so this may mean that screening for illicit substance use has been either pushed a little bit to the back burner, or the utilization of peer recovery coaches may have changed in the last month or so. A patient's perspective may have also changed in the last month or so, given everything that's going on. And so if a patient is not interested in currently cutting down or quitting at this time, or even if they are, we always, but especially now, want to encourage harm reduction techniques. And this card discusses specifically some harm reduction techniques during the pandemic. So what may be helpful if completing a discussion with the patient in person is showing the card to the patient if you're able to, or walking through the information as I'm about to do. And however, if you are having to follow up with patients afterwards, if you're not able to meet them face to face, you can discuss with staff again after discussing with your supervisor. Perhaps staff on site is able to hand out the information, or at least introduce some of the information to the patients initially. So first is minimizing sharing supplies. And so this is typically a common practice. We know that people who use together are often sharing the same supplies. This is especially risky at this time. We want to encourage the minimization or elimination of shared anything. And this doesn't just mean drugs or supplies for using drugs, but also e-cigarettes, vaping equipment. We want to make sure that patients are aware that this is a way that you can transmit COVID and other illnesses as well. And they should be especially careful at this time. If there's no way around it and they feel that they have to share supplies, please encourage them to clean the tool itself with an alcohol swab and let it dry before using. Minimizing contact is next. And we've all seen the social distancing guidelines that have been put in place, at least 6 feet minimally between individuals. And this applies for people that even you may know well and you may trust. It's especially risky in public right now because of the time it takes from when somebody might contract COVID to the time that they start showing symptoms. Most people, it takes a number of days and up to 7, 10, or 14 days for symptoms to start to show. And so many people may be walking around spreading the illness and they don't know that they're spreading it. So even if somebody appears well, or you just saw them a couple of days ago, it is still risky to kind of come within that area because the potential for transmission of the illness is significantly increased. And so please do remember that we're, again, even people that we know and trust very well, if we've not been quarantined with them, to maintain that social distance. Hand washing, good hygiene in general. And so showering, changing clothes, washing our hair is especially important right now, but by far, the most important thing we can do to reduce the spread of COVID is washing our hands and washing them well. And so we've all heard the 20 seconds singing happy birthday twice through. It may seem long when we're doing it for a full 20 seconds, but it is absolutely necessary and helpful in reducing the spread. Making sure we're using hot or very warm water, and that foamy, making sure that the soap is foamy, and rubbing our hands very well. Preparing for an overdose. Next on here. And so it's especially important now that a lot more individuals are using alone or are using or have access to possibly more substances than they've typically do, because maybe we stockpiled for a little bit. We were afraid that we couldn't get out for the next couple of days. And so you want to remind your patients to be especially careful that if they're using alone, to make sure that they start with a low amount and that they're using very slowly. Remind your patients also that if they're using with others to please try to obtain Narcan and to get trained on Narcan. So attached to the newsletter, along with this packet, is information about Narcan training and Narcan distribution kits, specifically in the Baltimore and DC metro area. But I do want to encourage you, if you're outside of that area, to please know where in your community you and your patients are able to obtain Narcan. Additionally, there is a link on don'tdie.org. Pretty easy to remember, pretty easy to encourage your patients to go to this website. There's a less than 5-minute free online training on the proper use of Narcan. Finally, we want to remind your patients to consider their needs, not just their substance use needs, but their social, mental, physical needs and coping skills. And so ask your patients, what do they typically do to relieve anxiety or to reduce stress? And hopefully they can use those tools or some new tools that you two discuss in relieving stress at this time. And we do want to encourage you to refer back to our other newsletters, which explain a lot of virtual resources for recovery and meetings. However, on the back of the information card, we do also have free NA, AA, Smart Recovery, and a number of other virtual meeting websites. And so my hope is that individuals who may not have wanted to physically walk into a meeting before may test out this virtual environment where they necessarily don't have to show their camera or really chime in. And maybe this will kind of open that opportunity and make them more comfortable with attending a meeting face-to-face in the future. So some other tips that aren't included on the card are to consider stocking up on supplies, maybe for a week or so at a time, so that you don't have to go out multiple times a day or a week. One thing to encourage your patients to do. Also encourage them to consider having medications that may help relieve withdrawal symptoms. And so possibly some medication to relieve like nausea or diarrhea or vomiting or body aches on hand to make it less painful if they do have to go a period of time without using. Having a partner that checks in on you. And so encourage your patients, if they are continuing to use, to make sure that they let somebody else know that they're about to use when they're at home. And that way that individual can check in 3 or 5 minutes and make sure that they're responding. Also, reminding your patients, as we always should be doing, not just now, but reminding your patients that any period without drugs can lead to an increase in your a lower tolerance. And so even that period of time where they might have been in the hospital or away for 8, 12 hours even, this can lead to a reduced tolerance. And so again, encouraging your patients to start lower and to be especially careful when using following any period of abstinence. Other helpful resources that are included in the newsletter, like I mentioned, include don'tdie.org with the free Narcan training, which is less than 5 minutes. Also, there's information about pharmacies, specifically in the Baltimore, DC metro area, but I encourage you to look up in your neighborhood and community where patients can receive Narcan. And I also included information on syringe or needle exchange programs. And what I included was a national map, and then you enter your zip code and it'll bring you to local resources for syringe or needle exchanges. Finally, on the newsletter, I did include information specifically for patients who may be HIV positive or living with AIDS. And this is especially important, I think, to discuss safer drug use and also social distancing restrictions with this population, because they do have a compromised immune system, which means they have a weakened immune system. And so it is important that individuals with HIV and AIDS are especially taking into consider these precautions and these restrictions, because if they were to get infected with their compromised immune system, this could be much more dangerous for them than a healthier individual. That's all I have for right now. Thank you for watching, and as always, stay healthy and stay safe.